Good morning, Dr. Eric Klaczynski here, Fanwood Back Relief Center, offering convenient, affordable relief of your back and neck pain. Today we're going to talk about running and your knees. It's often believed that excess running or doing a lot of long distance running creates arthritis in your knees, osteoarthritis over time. While sometimes this is true, new research has been shown that the converse is actually true. It actually helps to strengthen your knees if done properly and using appropriate measures. It can help to prevent osteoarthritis and also help with pain, decreased mobility, inflammation due to arthritis. But you have to do it responsibly, okay? Running is a great form of exercise. It's very popular because you don't need much equipment, just a good pair of running shoes, and you can do it almost anywhere. For this reason, it's a good form of exercise. Now, I will tell you, if running is uncomfortable or painful, or you do have advanced osteoarthritis, walking is going to be your best option in this manner, or swimming if you have access to that, because it is non-weight bearing as far as loading on the knees. But let's talk about 4 tips to help improve your running and avoid pain and osteoarthritis later down the road. Number 1, the obvious thing, we're going to practice good form. We want to try to avoid like we're walking on a tightrope or that crisscross leg pattern like you're walking on a high beam. The reason being is when you do this, it affects your knees, your hips, your ankles, and even your back. What happens is when you crisscross your leg one over the other, it causes your foot to excessively turn, and that causes a lot of stress on the ankle. It also creates what's called a valgus formation in the knees, where they start to kind of come together and put stress on the inner part of the knee, which can damage the meniscus and cause damage to the cartilage in the knee and start that process of osteoarthritis. So we want to avoid at all measures that crisscross pattern. Also, it causes internal rotation of the hip and can cause the same thing going on there as far as pain, inflammation, decreased mobility, and osteoarthritis. So very important that we're practicing good form. Also, a big thing is I see a lot of runners hunched over posturally, where their head's forward like this, their shoulders are rolled in, and this is not good as well. Always want to practice good posture, good form, whether you're sitting at your computer desk or you're walking or running. You want to keep your chest up, shoulders back, head over your shoulders, nice neutral posture. Minimize the loading on your head, on your neck, to help prevent those posture abnormalities over time. So always practice good form, uniform form where your head is resting over your shoulders, shoulders over your hips, hips over your ankles. Very important. I know when you get tired, we tend to lean forward. Try to avoid that at all costs or cut back on the amount of volume you're doing. So that's number 1, practice good form. Number 2, wear tight shoes. The right shoes. One of the ways you can determine if what's the appropriate shoe for you is putting your foot in water, and if your foot looks wide, you have flat pronated foot most likely, and a motion control shoe would be the best one, which is designed with a low or no arch foot, and that's what's recommended. We also want to avoid any type of stiff-soled shoes for excessive running, any major volume of running, because it reduces your ability to feel the ground, which is very important, leading to further injuries. If your foot looks skinny when it goes into the water, a cushioned shoe is designed for high arched foot because of the lack of pronation. This cushion type of shoe is going to help support you when you run, just in the same way that the motion control shoe would if you had that type of foot. If your footprint looks skinny and wide, a neutral shoe is designed for the formed arch foot is ideal. Okay. Now, if you're unsure as far as you can't tell if your foot is flat or skinny or wide, the best thing to do is go into your running store. They're trained in examining these types of feet and fitting you with the best shoe to avoid pain, injury, and problems later down the road. One of the important things is, though, if you're running a lot, what you want to do is you want to change your shoes frequently. When I say frequently, the advisement on this is every 250 miles, regardless of what the shoe looks like, regardless if it's causing you pain or not. You want to try to avoid, using shoes beyond their value as far as what they're suited to support your foot for. Okay. Tip number 3: avoid progressing too fast. We have this tendency when we're running, we want to do more and more and more. We want to get in better shape. We want to go further. We're training for a marathon. And the good rule of thumb with this is, if last week you ran 10 miles, the current week you're in of running, you would want to increase 10% each day, so that next week you're doing a total of 11 miles. You're not doing 20. So you're slowly, incrementally adding distance and time as you go to your running schedule. Hopefully that makes sense. And tip number 4 is we want to strengthen our legs and hips. And there's 3 exercises that are typically recommended for people that do a lot of running. The first one is a posterior lunge, and I'll go over all these. The second one is an advanced clamshell, and then a side plank leg raise. Okay. For those who do not know what these exercises are, I'll briefly go over them with you. If you have any questions, of course, on how to do these, then you can just give me a call, shoot me a message, and I'd be glad to go through them with you in the office. Let's start with the posterior lunge. So it's exactly what it is, okay? And instead of going forward with the lunge, we're going backward. So I like to put my hands on my hips. Let's move this back a little more. Okay, we're gonna start with one leg going back first. So if I'm going back with my right leg, I want to extend as far as I can. Again, keeping good posture, knee drops to the floor, and coming right back up. You want to go as far back as you can that's comfortable, that's not causing you pain. And then we're going to reverse and do the other side. Again, keeping the torso nice and straight. We're not leaning forward. We're not slamming our knee into the ground. We're slowly lowering, and then we're coming back up on that side. So that's the posterior lunge. What I would recommend with those is, start out doing a few on each side, see how it feels, and each day you can add more and more reps and sets. If you need specific recommendations, you can shoot me a message or give me a call. Okay? The next one is the clamshell. We're going to lay on our side for this. Okay? And it's basically what it is described as. We're going to raise our knee up like this. So we can get a nice stretch in the hip into the groin. Okay? Go up high as we can to the point where there's no pain, where it's comfortable. Okay? So we're going to do that clam just like that, opening up the hips. And then we're going to flip around and do the opposite on the other side. I'm not going to show you that, but you kind of get the idea. And then the last one is the lunge, the plank. So we're going to go up on our side for this. Okay, you can do it on your elbow, you can do it on your hand. For this purpose, I'm just going to show you on your elbow. And then what we're going to do is we're going to raise our leg towards the ceiling as high as we can and come down. Okay? Again, I would do this on the floor. I'm doing it for the purposes of you seeing it on the video. On the table, but on the floor would be better, so you can avoid falling over and hurting yourself. So those are the 3 exercises: posterior lunge, the clamshell, and the side plank. Okay. Again, if any of them are causing pain, discomfort, stop immediately. Consult with your physician. Give me a call. Shoot me a message. I can help you out. But they should not be causing any pain at all. You should only feel a gentle stretch. Always slow and controlled with each of them. Again, for specific sets and reps, just shoot me a message and I'd be glad to help you out. Of course, if your pain is worsening, you're having a lot of pain in your knees while you're running, and these are not helping, these 4 tips are not helping you, please shoot me a message, consult your medical doctor, and I'm sure you'll get the right direction as far as what's the best advisable treatment for your knee pain. Okay. That's all we have today. Again, I just want to recap 4 tips. Practice good form, wear the right shoes, avoid progressing too fast, and strengthen your legs and hips. Hopefully this helped you guys. If you have any questions, shoot me a message. Have a great day. Talk to you soon.